Yet another record number of new coronavirus cases in the state of Michigan, 8,516 positive tests over the past 24 hours. That smashes the old record, which was set yesterday at 6,900. Also today, the state reporting 118 more deaths from the virus, including 83 from a review of past vital records. So to give you just a little more perspective, a week ago today, there were 3,700 new cases, and today it is more than double that.
The fast-moving spread of the virus is not letting up despite dire warnings from experts and hospital leaders urging anyone who will listen to stay home and stay safe. Jason Colthorpe is live tonight. Jason, it just doesn't seem that the message is getting through to people.
Well, yes and no, Kimberly. I mean, you look at, we've all seen people who simply are not acting responsibly in all of this, but a lot of people are trying to reduce the number of people they see or the size of the gatherings they're in. But as doctors say, it's still not enough. And it only takes one encounter for the virus to spread. And that's why they're seeing increased numbers of COVID patients at hospitals like here at Henry Ford Health System. Despite continued warnings about masking up, distancing, and avoiding even small gatherings, COVID numbers are exploding. Today, Henry Ford Health System's top doc echoed that and is now worried about possible jumps in the number of people who will die.
From a national data perspective, we've had close to 1,200 deaths in the past 24 hours. And in Michigan, we are seeing almost 50 deaths per day over the next week. Definitely very sobering data.
In recent weeks, the rate of people testing positive was just 2 to 3%. It's now 13%. A shortage in testing supplies is also becoming critical, both nationwide and statewide.
100% of our testing, we were getting back the results within 24 hours. This has now extended to about 36 to 48 hours because of that supply shortage.
23% of COVID patients are in Henry Ford's intensive care units, which are at 80 to 90% capacity overall. And that's concerning. Not concerning, though, at least for now, is the number of ventilators because of what doctors have learned over the life of this pandemic in treating COVID-19.
In the spring, the belief at that time was that everybody needs to go on the ventilator early because it provides better outcome. We have learned that this is not the case, and accordingly, we are intervening with medical interventions, including high oxygen therapy before a patient is put on a ventilator.
So that's definitely good news. Doctors are also very excited about another vaccine they're working on here. This is in addition to the Pfizer vaccine that's getting good reviews so far, as well as the other vaccines being developed by the other companies. We'll have to see where that ends up. Kimberly.
Jason, I'm wondering, I know in the spring hospitals became COVID facilities only. Is Henry Ford still seeing non-COVID patients?
They are, and it's because when they did that the first time around, other patients, those cancer treatments, cardiac care, operations, transplants, all of that were put on hold, and it came at a great negative impact to those patients, and they don't want that to happen this time. However, as we see these numbers rise, doctors are worried that we could see that happen again as COVID patients start to increasingly take over space in the hospitals.
Let's hope
Kimberly.
that doesn't happen. Okay, Jason, thank you.